Help is on the way from Missouri hospitals struggling to keep enough staff to handle all the COVID-19 patients. Governor Parson says the state is hiring Vizient, a private medical staff placement company, to bring 760 nurses, respiratory therapists, and certified nurse assistants to Missouri. The governor says the state will use CARES Act money to pay for the program set to last 12 weeks.
For whatever the cost is, this is about saving people's lives. This is about taking care of Missourians, and we're going to do everything we can within our powers to do that.
And new tonight, KMBC 9's Brian Johnson looks at what one Kansas City hospital is doing to stay ahead of staff shortages.
At Truman Medical Centers and University Health, like many hospitals, staffing is low but manageable. They're doing their best.
We're having more challenges on the night shift and occasionally on the weekends.
Missouri has about 170 hospitals. Wednesday, Governor Mike Parson announced he'll hire a firm to add up to 760 more nurses and medical staff.
That's a relatively small number if you're spreading them out across the state, but every little bit helps.
Typically, ICU nurses treat about 2 patients. Floor nurses treat about 5. Hospitals are concerned because after each holiday this year, COVID-19 hospitalizations have increased.
The most important thing is for people to avoid gatherings of any sort outside of their normal bubble.
They stress masks, social distance, and wash hands. When staff runs low, there are only a few tools available: pay overtime, increase the patient-to-nurse ratio, or reduced scheduled operations.
We obviously prefer to see people practice the infection control.
Doctors say masks work, and the data shows counties with mask mandates have fewer new COVID-19 cases than those without mask requirements. Brian Johnson, KMBC 9 News.
Hospitals are helping each other. Children's Mercy Hospital says it offered to take pediatric patients from other hospitals to help with staffing. In Kansas, the first doses of the vaccine are expected by the end of the month. Governor Kelly says once a vaccine is approved, about 24,000 doses will initially be available from Pfizer. Moderna is expected to ship 49,000 doses. In all, Kansas could have 150,000 doses again by the end of the month.
With this schedule, we intend to protect the greatest number of Kansans, foster economic recovery, and get our kids back into our school buildings as quickly and safely as possible.
Healthcare workers and those in long-term care centers will be the first ones to get that vaccine. While you were asleep, the Pfizer vaccine was cleared for emergency use in the UK, meaning people there could get it next week. In the U.S., the FDA will consider Pfizer's application for emergency use 1 week from tomorrow. December 17th, the FDA will consider Moderna's vaccine candidate. Experts say it may be the spring before vaccines are widely available in the U.S. And once a COVID vaccine arrives, researchers will have a new way to track any side effects that people are having. As many as 40 million doses of the vaccine are expected to be available in the U.S. at first. The University of Kansas Health System medical staff there may be getting the vaccine, and then they may be asked to track symptoms using an app on their phones. That way, researchers will know in real time if there's a problem.
And so while we are confident, or hopefully confident, that the vaccines are going to be both effective and safe, we don't have all the data yet. I think that's a great idea that people can submit right off their cell phones what side effects they're having. So you're not relying on physicians to fill out those long, laborious forms that we get every time you put a patient on a drug. And you stop it on your phone. That'll be great.
There is a chance those first doses could be given in a couple of weeks' time. The Kansas Health Department plans to follow the CDC's new quarantine recommendation. The CDC now says if you think you've been exposed, you need to be in quarantine for 10 days, even if you have no symptoms, or for 7 days if you test negative and still have no symptoms. The CDC still recommends 2 weeks in quarantine is the best way to prevent the spread of COVID-19. 683 new cases of COVID-19 and 9 deaths are being reported in the 9-county Kansas City area tonight, with health officials cautioning these numbers could go down before a surge in a couple of weeks from Thanksgiving. Here's a look at COVID spread across the 9-county area, with most of those cases still in Johnson County, Kansas, and Kansas City, Missouri. There's a new warning coming from the White House COVID task force, one that's not being shared with Americans, as ABC's Karen Travers reports.
The COVID risk to all Americans is at an historic high. That's the urgent and blunt message to the nation's governors this week from the White House Coronavirus Task Force. A new document obtained by ABC News says that all Americans under age 40 who gathered with anyone outside immediate family at Thanksgiving should, quote, assume you became infected. It goes on to say those younger Americans are dangerous to others and should isolate from anyone high risk and get tested for COVID-19 immediately. The task force also says all Americans over the age of 65 or with significant health conditions should not enter any indoor public spaces where anyone is unmasked. But this critical public health information was only shared with governors, not with the American people. ABC's Inez de la Cotera asked White House Press Secretary Kayleigh McEnany why not. McEnany appeared stumped.
You said that was in a, what document was that? There's CDC guidance out there as to when you should and should not isolate, so I would point you to that. That's all been publicly available since the beginning of all of this.
Despite that historic high risk of COVID-19, the holiday receptions at the White House go on. Officials there are not commenting on these images that were live streamed during a party Tuesday night. It was packed with people, shoulder to shoulder, many not wearing masks. The First Lady's office said last month that even though the holiday receptions would continue this season indoors, masks will be required and social distancing encouraged.
The U.S. Surgeon General told ABC last month that events like that could become super spreader events. The White House has already had at least 3 outbreaks of COVID-19 just since October. Karen Travers, ABC News, Washington.
Pressure is mounting on lawmakers on Capitol Hill to reach a new COVID relief deal before the end of the year. Senate Majority Leader Mitch McConnell is pushing a bill that includes a month-long extension for unemployment insurance. Democrats insist a bigger bill is needed.
It would create a second draw on the job-saving Paycheck Protection Program to prevent more layoffs.
The Republican leader should not waste the Senate's time on another inadequate partisan proposal.
Treasury Secretary Steve Mnuchin says another round of stimulus checks appears to be off the table for now. As expected, Missouri state lawmakers are passing that $1.2 billion COVID aid package. There's federal money for testing, contact tracing, lab equipment, and data collection. It now heads to Governor Parson's desk for his signature.